Welcome to an NCI Data Spotlight. This spotlight is about racial equity. In 2020, the COVID-19 pandemic and the events surrounding the death of George Floyd exposed indisputable disparities and injustice experienced by non-white racial and ethnic groups in the United States. These historic inequities have created disparities in areas such as housing, income, employment, and nutrition. People with intellectual and developmental disabilities may already face stigma related to ableism. For people with IDD who are part of marginalized racial and ethnic groups, that stigma may overlap with inequity and disparities. What can NCI data tell us? A closer look at the experiences of Black and white respondents begins to show areas where disparity may exist. Compared to white respondents, Black respondents were more likely to live with parents or relatives, and compared to white respondents, Black respondents were less likely to report choosing or having input in where they live, or who they live with. Black respondents were less likely than white respondents to use self-directed supports. Compared to white respondents, Black respondents reported a desire for greater community involvement. Compared to white respondents, Black respondents were more likely to report they wanted to go out more often than the previous month, to go shopping, for entertainment, to a restaurant or coffee shop, and to religious services or spiritual practice. Compared to white respondents, Black respondents were less likely to have a paid community job, and more likely to want a paid community job. Diagnoses and healthcare. Compared to white respondents, Black respondents were more likely to be diagnosed with high blood pressure, severe or profound ID, psychotic disorder. Compared to white respondents, Black respondents were less likely to have had a routine dental visit in the past year, or to have had a flu vaccine in the past year. These findings suggest that disparities in the experiences of Black and white participants do exist, but this is just the start of a much larger conversation. More information is needed about the availability, accessibility, acceptability, quality, and utilization of services and supports. This requires a closer look at data, conversations with Black participants and their families, and a closer look at how policies and regulations unintentionally further these disparities. NCI's data comes directly from people with intellectual and developmental disabilities across the 39 states who took part in the 2018-2019 NCI in-person survey. This analysis includes more than 15,000 white respondents and more than 3,000 Black respondents. A more in-depth look at the data in this video can be found in the NCI data brief on racial equity. Learn more about NCI at www.nationalcoreindicators.org. For questions and comments, contact Alexandra Bernardi, NCI Project Director, a Bernardi at hsri.org.